Hello everyone, Jacquet here. Just wanted to touch base with you guys. I'm going to adjust this camera just a little bit for you guys, okay? Okay, there we go. Jacquet here. I wanted to touch base on something that quite some folks have been asking about this, and they do want to know, when it comes to Medicare, exactly what is, Part A. And many folks doesn't really quite get when it comes to A, B, C, and D, and and all these different parts when it comes to that. Today, I want to touch base. This video is solely on Part A. What is Part A? Why is it important? What does it do? And is it something that's worth having? Is it something that someone should have? If it's something that's necessary. So I'm going to tell you, yes, it is something that you should have, Part A of your Medicare. And that's not the only part that's important. All the parts are important. All the parts play their own roles. Every single one of them do their own thing. But Part A is hospitalization, and is very important. And the importance of it is when you go to the hospital, it plays a major role, a major part into you getting the services that you need and to getting things that you need to get done. Part A is so important that, you don't want to wind up with a bill from the hospital. Let me adjust this a little bit more again. Okay, there we go. I feel like you guys could see me a little bit better. So Part A is so important. You don't want to go into the hospital and wind up leaving with such a huge bill, and then you're saying that you thought you had coverage and you don't understand where, this bill is coming from, and you calling left and right, and they're like, well, did you get these services? And folks are saying yes. And you're like, well, how come I'm not covered? There's a couple of ways to get Part A. It's either through the time that you was working and, you paid into having Part A, then you become to have Part A, you paid for Part A, so it's free. It's free, you're entitled to it. Or either your spouse, worked along those years and you wind up having Part A. So another way is if you didn't work and then have the accumulated credits, so you can pay for Part A. You can pay for it. I would definitely say, it's better to work than pay for it as along the line as you are working, because, things could get expensive. Especially, you don't want to start paying when it comes to being, having your medical when it comes to a certain time when you're supposed to be relaxing and kicking back. Now, some folks doesn't know this. If you don't take Part A, or there is a penalty to not having Part A. There is a penalty for not having Part A, just like there's a penalty for every single one of them if you don't have them in place. So be very careful about that. Be very leery about that, because you don't want to wind up with penalties that you got to pay back, all because you didn't have the proper information and you didn't have the proper understanding of what really going on. Saying this, if you are new to Medicare, let me know so I can help you and guide you, and so I can let you know the information right on, so you know exactly what to do and how to move forward and how to navigate through the system of healthcare, Medicare healthcare. I am here for you, and once again, I am Jacquet. Don't forget to thumbs this video up and help me share it with your friends and family members, or you never know who might need to hear this. Any questions, comment down below, send me a message. I will definitely get it in response back to you guys. I'll speak to you guys soon.